Welcome back to the course on nutrition and planetary health, presented by the Physicians Association for Nutrition and PANCO. This course provides an evidence-based foundation for how dietary patterns influence both human health and planetary health, and how this knowledge can be applied in clinical practice to promote healthy and sustainable diets. Let's begin with the fourth module on healthy and sustainable diets. Ready to dive in? Let's get started with learning what a healthy and sustainable diet is. After examining the health impacts of diets, the environmental impacts of food systems, and examples of healthy dietary patterns in the previous lesson, an important question emerges. What exactly constitutes a diet that is both healthy for people and sustainable for the planet? Before you begin this lesson, please answer the following question. This ungraded question is designed to get you thinking. If you are unsure, take your best guess. Which of the following statements best reflects current global modeling evidence? A. Healthy diets and environmentally sustainable diets are largely incompatible. B. Only fully vegan diets can achieve meaningful climate mitigation. C. Diets rich in whole plant foods and moderate in animal source foods can substantially reduce premature mortality and environmental pressures. D. Current global diets are broadly aligned with both health and planetary targets. The correct answer is C. Diets rich in whole plant foods and moderate in animal source foods can substantially reduce premature mortality and environmental pressures. In this lesson, we bring together evidence from epidemiology, environmental science, and modeling studies to define the key characteristics of healthy and sustainable diets. In earlier lessons, we examined two major streams of evidence. First, large-scale epidemiological analyses estimate that a suboptimal diet contributes to approximately 11 million deaths annually worldwide, largely through cardiovascular disease, type 2 diabetes, and certain cancers. Low intake of whole grains alone accounts for nearly 3 million deaths per year, and low fruit intake for approximately 2 million. Diet-related risk is therefore not marginal. It is central to the global burden of disease. Second, we examined the environmental footprint of food systems. Food systems contribute approximately 30 to 35% of total anthropogenic greenhouse gas emissions and are also major drivers of land system change, freshwater use, biodiversity loss, and nitrogen and phosphorus disruption. The question now is whether these streams of evidence converge or conflict. A healthy and sustainable diet can be defined as one that reduces the risk of diet-related diseases while operating within the biophysical limits of climate stability, land use, freshwater use, and nutrient cycles. This definition integrates human health and planetary health rather than treating them as competing objectives. The key question is whether dietary patterns can satisfy both criteria. Synthesis work by the Eat-Lancet Commission and multiple independent modeling studies identifies consistent structural characteristics. The planetary health diet developed by the Eat-Lancet Commission is characterized by whole grains providing approximately 30 to 35% of total energy intake, daily intake of fruits and vegetables in the range of 400 to 600 grams, regular consumption of legumes, pulses, nuts, and seeds, reduced amounts of dairy, eggs, fish, or poultry, limited red meat and processed meat, and minimal added sugars and refined starches. These values represent global reference ranges for the planetary health diet and can be adapted to demographic and regional contexts. Nonetheless, the structural pattern is consistent across analyses. What is important is the convergence between these evidence bases. Dietary patterns associated with lower cardiometabolic risk are also those associated with lower greenhouse gas emissions and land use intensity. This suggests broader alignment rather than a trade-off in the overall structure of the diet. To evaluate the potential for health and environmental improvements, we must first look at how current dietary patterns compare. Globally, most populations consume insufficient amounts of whole grains, fruits, vegetables, legumes, and nuts, while consuming excessive amounts of red and processed meat, sodium, and refined grains. In many high-income countries, average red meat consumption exceeds recommended levels by 2 to 5 times. In contrast, Intake of legumes and whole grains frequently falls below half of the recommended targets. In simple terms, current global diets tend to include too little of the foods linked to better long-term health, and too much of the foods linked to both poorer health outcomes and higher environmental pressure. From an environmental perspective, continuation of current dietary trends is projected to increase food-related greenhouse gas emissions by 30 to 80% by 2050 relative to 2010 levels. Land use and nitrogen application would expand correspondingly, further transgressing planetary boundaries. Thus, the prevailing global dietary trajectory is incompatible with both population health optimization and environmental stability. A robust body of modeling research has examined how different dietary patterns could affect both health and the environment at a global scale. In a global modeling analysis spanning 150 countries, Springman, Weeb and colleagues evaluated flexitarian, pescatarian, vegetarian, and vegan dietary scenarios relative to projected 2050 baseline diets. They estimated reductions in premature mortality of 19 to 23% globally, prevention of approximately 7 to 8 million deaths annually under mid-century population projections, and reductions in food-related greenhouse gas emissions of 29% for flexitarian diets and up to 70% for vegan diets. The key message is that the same broad dietary shifts, especially moving towards more plant-rich patterns, are associated with gains for both population health and environmental outcomes. Similarly, Springman, Clark and colleagues projected that dietary shifts toward plant-rich patterns could reduce food-related greenhouse gas emissions by more than 50% and prevent approximately 10 to 11 million premature deaths annually by 2050 relative to reference scenarios. Another modeling study by Tillman and Clark reported reductions in greenhouse gas emissions of 63% and reductions in agricultural land use of 76% under global vegetarian adoption relative to projected 2050 baseline diets. Across different modeling approaches, the overall direction is consistent. Increasing the proportion of plant-derived foods while reducing high-impact ruminant meats is associated with substantial reductions in mortality and environmental pressure. An important question concerns real-world dietary guidance. Springman and colleagues analyzed 85 national food-based dietary guidelines and modeled their environmental implications. If fully implemented, these guidelines would reduce global greenhouse gas emissions by approximately 13% relative to projected baselines. However, alignment varied considerably across countries. Guidelines emphasizing plant-based foods and limiting red meat performed better on both health outcomes and environmental metrics. Many guidelines, however, were not explicitly designed to account for planetary boundaries. This shows that public health, nutrition, and sustainability are beginning to come together in policy, but the integration is still incomplete. Affordability and equity are central to understanding whether healthy and sustainable diets are realistic in practice. Springman and colleagues estimated that globally defined healthy and sustainable diets cost approximately 60% more than current average diets in low-income countries, rendering them unaffordable for more than 1.5 billion people in 2017 price terms. In contrast, in middle and high-income countries, plant-rich diets are broadly affordable and may be cost-saving when reductions in healthcare expenditures are considered. Regional differentiation is therefore essential. In settings characterized by undernutrition or micronutrient deficiencies, moderate increases in nutrient-dense animal source foods may improve nutritional adequacy without substantially exceeding environmental limits. In contrast, in high-income settings characterized by excessive meat consumption, reductions in ruminant meat intake offer significant mitigation potential. Healthy and sustainable diets should therefore be understood as flexible, context-sensitive frameworks rather than one uniform prescription. Evidence suggests that healthy and sustainable dietary patterns can be built within many different cultural traditions. An Indian thali structured around lentils, seasonal vegetables, whole grains such as millet or brown rice, yogurt in moderate amounts, and occasional fish or poultry, if preferred, aligns with plant-forward principles while maintaining cultural continuity. A Mediterranean dietary pattern emphasizing legumes, vegetables, whole grains, olive oil, nuts, and modest fish intake if preferred, has demonstrated cardiovascular benefit in randomized trials such as PREDIND, and is associated with lower greenhouse gas emissions compared with Western meat-rich diets. An East Asian dietary pattern centered on rice or noodles, tofu, leafy greens, fermented vegetables, and small portions of fish, if preferred, similarly reflects a plant-rich structure. Across these examples, the defining feature is balance and proportion. Plant foods form the foundation, while animal source foods are present but not dominant. Modeling evidence suggests a gradient rather than a threshold, as the share of plant-based foods increases relative to high-impact ruminant meats. The health and environmental gains tend to increase as well. At an advanced level, it is also important to recognize the limits and complexities of this evidence. Nutritional adequacy should be monitored and maintained, particularly for micronutrients such as iron, vitamin B12, and zinc. Certain plant foods may exert high local water pressures in water-scarce regions. Ultra-processed plant-based products may have lower greenhouse gas emissions, but their health impacts can vary. Structural affordability barriers persist in low-income contexts. Dietary change is, therefore, necessary, but it is not sufficient on its own. Complementary reforms in agricultural production, food waste reduction, and subsidy structures can be helpful. Taken together, the converging evidence from epidemiology, environmental modeling, and economic analysis points to a coherent conclusion. A healthy and sustainable diet is characterized by predominant intake of whole grains, legumes, fruits, vegetables, nuts, and seeds, protein derived largely from plant sources, none to moderate amounts of dairy, eggs, fish, or poultry, if preferred, limited red and processed meat, minimal refined grains, added sugars, and ultra-processed foods. It is defined by overall balance rather than strict exclusion. Increasing the proportion of plant-derived foods relative to high-impact animal source foods is associated with improved population health outcomes and reduced environmental pressures. Before we wrap up this lesson, let's look at the key takeaways to recap what we learned. Diet is a major driver of global health outcomes, contributing to an estimated 11 million deaths annually through cardiometabolic diseases. Food systems also exert substantial environmental pressures, accounting for roughly 1/3 of global greenhouse gas emissions and driving disruptions to land, water, and nutrient cycles. Healthy and sustainable diets reduce chronic disease risk while operating within planetary environmental limits. Across multiple studies, diets rich in whole plant foods and lower in ruminant meat are consistently associated with both improved health outcomes and lower environmental impacts. Current global dietary patterns are misaligned with both health and sustainability goals, with insufficient intake of whole plant foods and excessive intake of red and processed meat. Healthy and sustainable diets are not a single universal diet, but a flexible framework that can be adapted to different cultural food traditions and regional contexts. Affordability and access remain important barriers in some regions, highlighting the need for broader food systems and policy changes alongside dietary shifts. Overall, shifting towards a higher proportion of plant-based foods while reducing the intake of high-impact animal source foods can improve population health and reduce environmental pressures. Before you move to the next lesson, let's assess your learning through a quick question. Based on what you learned in this lesson, answer the following question. Which statement best reflects current global modeling evidence on diets? A. Healthy diets increase greenhouse gas emissions. B. Plant-rich dietary shifts can reduce mortality by 20% while also reducing food-related emissions. C. National dietary guidelines are fully aligned with planetary boundaries globally. D. Cultural food traditions prevent adoption of sustainable diets. The correct answer is B. Plant-rich dietary shifts can reduce premature mortality by approximately 20%, while also substantially reducing food-related emissions. This reflects the central finding of the lesson. Current modeling evidence suggests that diets richer in whole plant foods and lower in high-impact animal source foods can support both human health and environmental sustainability. This lesson has integrated epidemiological and environmental evidence to articulate a structured definition of healthy and sustainable diets. The evidence base suggests convergence rather than contradiction. Diets that reduce cardiometabolic risk are broadly aligned with those that mitigate environmental degradation. In the next lessons, we will move from definition to implementation. How can these principles be translated into everyday clinical practice, meal planning, and patient counseling? We would value your feedback. Please scan the QR code on screen to share your thoughts on the course content and help us improve this learning resource. Thank you for watching this lesson. This is the course on nutrition and planetary health, developed and presented by the Physicians Association for Nutrition and PANCO. You can now move on to the next lesson.